If you are suffering from watery eye, whether in both eye or maybe in just one at a time. At first, let's understand how tears are formed in the eye. There is one gland called lacrimal gland which produces tears in the eye. This tear flow down keeping the eye moist and drain out the tear duct in the eyelid into the nasal cavity. In a normal situation, tears are continuously produced. The same quantity of tear keep getting drained out through the tear duct. This way, tears do not overflow out of the eye. But if due to some reason excess tears are formed in the eye or sufficient tears are not draining out through the tear duct, so excess tears will be accumulated in the eye, but the eye does not have enough cavity to hold on to the tear, so this tear overflow out of the eye. This is how a watery eye problem starts. Now, there can be another situation, either the gland produces excess tear or the dryness through tear duct is stopped. When you produce too much tear which is beyond the holding capacity, so you develop watery eye. When does the lacrimal gland supply excess tear? First, when you feel emotional stress like weeping or being overjoyed can cause excess tear. But this is not medically related. Second, there are medical reasons also, like sty, if an eyelid turns inward so that the eyelashes irritate eye, or an infection, inflammation or an allergy. Infection can happen on the cornea, conjunctiva and the white or dark portion of the eye. Extremely dry eye can cause the body to produce excess tear to keep the eye moist. These are some causes for watery eye. Your eye doctor will examine you for such problem. In other cases, tears are produced in a normal quantity, but it cannot be drained from the nasal cavity. Now, how can that happen? First, you need to understand that the process of tear formation and the dryness through the tear duct, it works like a pump machine. Blinking your eye activates the pump to drain tear through the nose. If this system does not function well, maybe this pump is not able to suck out the tear through the tear duct, causing tear to accumulate in the eye and eventually overflow. There is a tiny hole at the inner corner of each eyelid. It's called puncta. The tear drains out the nasal cavity through this hole. This whole punctum may get blocked due to inflammation, infection, injury or burn. There could be a blockage in any of these tear duct tubes. Blockage in any part of the tear pump can cause excessive tear to build up and overflow from the eye. At first, your doctor will examine your eye whether they are fine or not. If your eye are fine and still water is coming out of your eye continuously, then now your doctor will examine tear pump system. Your doctor will check whether the punctum is blocked or not by slit lamp, but the function of the tear pump is unseen and can only be examined with the help of syringing test. In this test, saline is injected through the upper or lower punctum into the nasolacrimal drainage system. In a healthy patient, the saline could drain through the nose. The doctor will ask if the patient filled the saline into the throat or not. If yes, then the tear pump system is functioning well. But if the lower ampulla tube is blocked, now how it is identified? If saline injected through the lower punctum drain out from the same hole, but saline injected through the upper punctum drain from the nose, it means that the problem is in the lower ampulla tube. This all helps to identify which tube has a problem. Now talking about a treatment, these blockage areas are usually operated. The procedure can be done with or without a tube. A doctor may use various ways to solve the blockage problem. The most common procedure is called DCR operation, dichrocystoRhinostomy operation. This procedure is usually performed by endoscopy through the nose using a tube and a laser without any skin